When I tell people I'm an ICU nurse, the first thing that comes to their mind is the beeping of machines, patients being on ventilator, doctors rushing in to save lives. While that may be true, there are certain things that nobody talks about being an ICU nurse. Today, I'm sharing things about being an ICU nurse that nobody talks about. Things I wish someone would have mentioned to me before I became an ICU nurse. Whether you're a nursing student, or you're already a practicing nurse, or you're just curious about what happens in the ICU, here are 7 things you need to know. Hello, everyone. Welcome back to my YouTube channel. My name is Goreti. I'm an ICU nurse in Nigeria and also a US registered nurse. On this channel, I bring you topics on ICU nursing, NCLEX tips, international nursing opportunities, health, and lifestyle. If you're interested in becoming a better nurse, hit the subscribe button because that's all we do here. Back to the topic of today. ICU nursing is more about thinking rather than running. I know when you picture the ICU, you picture running around to save life, performing CPR. However, what you do not know is that ICU nursing deals more on critical thinking. You anticipate what will happen before it even happens. You think about your patient in the future. You assess your patient. You interpret lab results. You anticipate whatever that could happen before it actually happens. While there may be emergencies in the ICU, most of what we do in the ICU involves critical thinking. A small change in a patient's blood pressure, oxygen saturation, can be a first pointer that something is going wrong and you need to find out what it is. Number two, every beep does not mean that a patient is dying. Working in the ICU has acclimatized me to the sound of beep. Yes, you may be watching your movies and see that in ICU, beep certainly means that a patient is dying. But in reality, it's a different case. The machines could beep for so many reasons. It could beep because the patient just moved. It could beep because the IV infusion pump needs an attention. It could be for numerous reasons, and we as ICU nurses have learned to recognize which machine is beeping and why it's beeping, and whatever attention that it's needed. Number three, ICU nurses never stop learning. As an ICU nurse, you always need to be up to date on the things that are happening in the medical field. You need to update your knowledge on drugs. You need to update your knowledge on laboratories, on different diagnoses. You keep learning, you keep being on your tools, participating in presentation and continuing education. It is very important because you are dealing with critically ill patients. Number four, families need care too. Working in the ICU can actually be mentally draining, especially when you look at your patient's family. Because most of the time, seeing your loved one in such a critical condition takes a whole toll on you mentally. Being an ICU nurse helps you understand that these patient relatives are in critical and emotional turmoil. And you're not just nursing the patients, but you're also nursing the families by engaging them and keeping them up to date on the well being of their relative. I've once worked in a very emotional case, a case that for confidential purposes I won't be diverging, but it was a very emotional case for me simply because anytime the patient's relatives come in into the ICU to visit their loved one and see their loved one, they break down. They break down in tears. And sometimes, as a nurse, watching that scene can actually have a serious emotional impact on you. Number five, Teamwork saves lives more than you can imagine. It is in the ICU that I witnessed what teamwork is all about. In the ICU, only the nurse does not work alone. There are different teams that come together, different specialties that come together in order to nurse a patient back to recovery. In the ICU, nurses work with doctors from so many specialties, respiratory therapists, physiotherapists, laboratory scientists, and so many others, even technicians. So many people come together in order to make the patient better. Number 6, some patients recover against all odds. I've actually lost a patient that I thought personally was not going to make it. Yeah, I did my best for this particular patient. But within me, I was like, wow, it's going to be a miracle for this patient to make recovery. But it blew my mind because that patient made a full recovery more than I expected. So sometimes ICU, or most times ICU, is not a death sentence. That patient that you think may not make it may just be the one that will blow your mind. Number 7, if you think you're not empathetic, come to the ICU. ICU nursing can change you. Personally, I have been changed by ICU nursing. Being an ICU nurse has opened my eyes to view life differently. It has opened my eyes to know that this life we are is actually quite fragile, and that within a twink of an eye, someone that is well and breathing could just become a vegetable. Someone that you were once gisting with within a space of 1 minute, the next minute could be dead. This has opened my eyes in so many ways, and it has made me to begin to appreciate life in a different way, and also appreciate good health more than you can imagine. Although being an ICU nurse is actually quite challenging, but it's one of the most rewarding specialties you can think of in nursing. Every day is an opportunity to learn. Every day opens your eyes to so many different opportunities. So if you're a nursing student or you're already a nurse planning to venture into ICU, I will encourage you to do just that. Yeah, it may be daunting at first, but you will get the hang of it. Just lock in there. If you enjoyed this video, kindly give me a thumbs up and subscribe to this channel. Like I said, I bring you topics about nursing, health, and lifestyle. Stay tuned for my next video, and bye for now.